Well, welcome. I'm Dr. Doug Evans, and we're continuing our series of videos with our patients to try to serve as an inspiration for all of you who may receive a diagnosis, especially today. The topic is pancreas cancer. For those of you who receive a cancer diagnosis, hopefully you'll find Carol's story inspirational. I'm here with Carol Rubatt, and Carol, thank you so much for joining me. I usually use Mr. and Mrs. in the hospital, but on the radio and the videos, we oftentimes go first names if that's okay.
Of course.
Your story with pancreas cancer is, is really fascinating, and I think for those people who have recently received a pancreatic cancer diagnosis, or if you're struggling with the thought of having surgery, or in fact struggling with some complications after surgery, I think Carol's story is particularly important. The operation now was a little over 2 years ago, in January of 2021, but you had chemotherapy and radiation first. Maybe we could start with how you were diagnosed, and then how you ended up coming to us.
Okay. Well, it basically all started August 20th of 2020 during the pandemic. I was babysitting my granddaughter who was just 2, and the day was fine. It was just fine. And I took her home, and I said to my son at that point, I go, geez, my stomach just isn't right. And I remember him saying, he goes, yeah, I had a little bug in me. He goes, over the weekend I wasn't feeling so good. So I left. On the way home, I had to pull over and throw up. And so I think I have a bug, a little flu bug. And that went on for a few days, and it just, everything I was eating was coming up. So I went to urgent care, and they too said, it's probably just a bug, it's just a bug. I go, but I don't feel sick. And then it got a lot worse. So I called my doctor, who I've known since he was 13 years old, a friend of the family. I called him at home that night, and I said, something's not right. He says, come on in. He goes, we'll do a CT scan. So I go in the next morning, and we're talking, discussing our families and so forth. And he goes, yeah, maybe it's just your gallbladder, that type of thing. Just never thinking it was anything so serious. And in retrospect, now I realize why it took so long to get those results. And he comes back, and he says to me, it's not good news. And he just held me, and he goes, you got pancreatic cancer. And you just, I think immediately you just go into shock.
Oh, sure. Absolutely.
And just, I just didn't know what to do. And so he calls my husband, who was babysitting our youngest granddaughter, was just 2 months. I was supposed to be doing that now for a few months.
Yeah.
And tells him, and he says, I want you to meet her in the emergency room. We're going to take her by ambulance to Frederick. And I'm just like, you're kidding me. Can't I go home, take a shower? And it's like, no, we got to get this taken care of, because I think since everything was coming up, I think they were afraid of something bursting probably.
Okay.
And so I was rushed by ambulance to Frederick and met by a team of doctors. And prior to going in the ambulance, they gave me a tube down my nose and so forth. And so I could, eat again, so I wasn't throwing up all the time and so forth.
Yeah.
And then, like I said, I was met by a team of doctors. The next day, Dr. Higgins performed let me see if I say this right, gastrojejudomoscopy.
Yeah, a gastrojejunostomy. I think you had a situation where the tumor had blocked the outlet of the stomach.
Yes.
And one of the ways that we treat this so that we can get you on chemotherapy fairly quickly is we have an amazing group of minimally invasive laparoscopic, robotic surgeons. They also do all the bariatric or weight loss surgery. So Rana Higgins is really talented surgeon who does that. So she did this laparoscopically,
right.
I suspect.
Right.
Right. So she just hooked a piece of intestine a little ways away from the stomach, hooked it up to the stomach, so we could bypass the area that was blocked. You could then eat.
Right. Right.
And
I recovered so well from that. Yeah. Everything was just fine. And then you came in, I think maybe a day later, I met you, and then, there was a biopsy and so forth. But one of the things I remember is my daughter talking to Dr. Higgins and asking her, did you see anything floating around? And she said, no. And that just made such a difference in my attitude.
Because your daughter is a gynecologic oncologist, right?
Yes.
So she's a cancer doctor.
Yes.
Dealing with ovarian cancer and uterine cancer, cervical cancer, all of that. And so obviously knows a lot about cancer. So
a great resource.
Yeah.
And daughter. And so that just gave me, I just felt positive then that, okay, I can do this. And so then I had the biopsy and so forth. I was in the hospital 6 days. And then when I came to see you, which was September 8th, you told me that I asked you to stage it, you would not stage it, and you said you are borderline resectable. Okay.
yeah, with pancreas cancer, the 1, 2, 3, 4 doesn't lend itself as well to pancreas cancer. So you're using the 1, 2, 3, 4 staging. It would have been in the 3 category to begin with. Stage 4 means the cancer is spread to another part of the body.
Right.
In general, for solid tumors. Stages 1 and 2 are localized to the organ where it started with and are easily removable. Stage 3 is that gray zone removable kind.
Yeah.
So some people might have put yours into stage 2. Here at the Medical College of Wisconsin, we would have put it into stage 3. But again, the 1, 2, 3 doesn't lend itself to pancreas as well as. It's fascinating because the 1, 2, 3, 4 staging of solid tumors in cancer is probably the only thing that the entire world agrees on. But it isn't that adaptable to pancreas. But you went on to get some chemotherapy, right?
Right. So then I was scheduled to have 8 cycles. And after the 4th complete round, I had another CT scan, and the results weren't that favorable. You looked at it and you just didn't you wanted to see better results. And so you decided, okay, we're going to abort the chemo right now and start radiation. You moved up my surgery date by about 2 months because it was supposed to be the end of March.
Oftentimes, again, for the people watching, we typically give 4 months. The usual paradigm for patients with pancreas cancer that we think we can remove is 4 months of chemotherapy followed by radiation and then surgery. The one thing that I think we're leading really the world in here is what we call an adaptive approach to the treatment of our patients. In other words, we reassess after 2 months. And if things aren't better, and usually we don't think staying the same is good enough, if things aren't better, we pivot. Either we move to radiation, and in your case, I think we did that because we couldn't afford to have your tumor grow anymore.
Right.
We were afraid we would lose the opportunity to remove it.
Yeah.
But occasionally we will switch the chemotherapy as well.
So hearing that was not great news, like, oh my gosh, chemotherapy is not working. Because, I knew you were going to do what you had to do, and I knew what I was going to do. I was going to fight like heck, and then that wasn't real favorable. But,
How'd the radiation go?
Fine. It did. The effects of it showed up a lot later.
Yeah.
But yeah, with the radiation, everything went just fine. I had chemo with radiation as well. What I tell people I know someone right now who's going through radiation, I go, yeah, you're going to get very fatigued like 2 weeks after it's all over.
Yeah, that can oftentimes happen.
Yeah,
and who was the doctor involved in your radiation?
Dr. Hall.
Yeah, he's so great.
He is.
Yeah, really, really brilliant. Bill Hall is amazing. So then we did the surgery after the radiation.
Right. So radiation ended the end of December, after I got my Bomba socks.
Yeah, that's right. Yeah, and I'm not wearing them today.
Oh, no,
my goodness.
I have mine on.
Yeah.
But I only had 365
you have to tell that story.
I always said to my kids, if I ever won the lottery, I'd put on a brand new pair of Bomba socks every day because I just love the feel of new socks.
Yeah.
You know, but that was just my little frivolous thing. So they decided that they were going to, this is my 3 sons and my daughter, and they go, let's get her those socks. And so they contacted Bombas to see if I'd get a deal. They could get me some type of deal or get themselves a deal. And they go, we got this. And they sent 365 pairs of Bomba socks to me, all different colors, all different lengths, and so forth. So, and I obviously have donated many of them to the nurses and
You've
so
given
forth.
me a couple pairs.
Yeah, I gave you some as well.
I mean,
Dr. Hall, I gave some to, and yeah, Dr. Kamgar, Mary Beth, yeah, but definitely that was my,
I mean, so great.
still putting out new ones. And yeah, all the nurses that I had in the hospital, all my chemo nurses, everybody, you know, that helped
Yeah.
me along the way got some Bomba socks.
One of the things that we wanted to focus on was you needed a particularly big operation, and we have started this new series of videos that we have entitled Pancreas School, where we talk about the Whipple operation, we talk about the importance of the blood vessels, and in your case, you needed all of the blood vessel work. We had to deal with the arteries, the veins, and everything. And as we've said in both Pancreas School and maybe some other videos, the entire body has a nervous system, but the nerves that go to your intestines and your liver and your stomach and everything, they're interpreted in a different part of the brain, not in the cerebral cortex, in the big part of the brain, but actually in the brainstem. But the nerves that go to your small intestine, which course along the artery called the superior mesenteric artery that travels right behind and next to the pancreas, those nerves are a brake pedal. So they prevent your small intestine from peristalting too fast and from food going through you too quickly. So when we remove the nerve, and in your case, in order to get the whole tumor out, we had to remove that nerve. We removed the brake, and so you had rapid transit of food through your GI tract, resulting in some weight loss. The weight loss seems to be more significant in people who are a little on the slender side to begin with. And of course, it's, in my experience, it's exactly proportional to the magnitude of the surgery. So that was a kind of a big problem for you.
Right.
Right?
Right.
Maybe tell our viewers about that and how you've adapted to this over the last couple of years.
Well, okay, so to get an idea, when I was always around 135 pounds. I got down to 102. That was my lowest. That was my lowest. And eating was an issue because everything's going through me. You know, at first it's just like, I might as well just eat on the toilet, you know, because it's just going through me. And that's how it was. And it took a while for my body to adapt that I could start gaining weight. You know, and just a lot of protein, a lot of the protein drinks, protein bars, and so forth, chicken, fish, and so forth, and just small meals, lots of them a day. And it's just that I think it's just a process this new system of mine had to adapt to. I'm 115, 116 pounds now. I'd like to put on another 5 for sure. I think I will.
Yeah.
You know, but
and how do you integrate pancreatic enzymes and the anti-diarrhea medications?
Okay.
You know, I know we've probably been through cycles of this.
Yes.
But how are you integrating them now?
Well, I'm on Zenpep, which is the enzymes that I have to take with everything that I eat. I still think I'm on a large dose. I take like 6 at a meal, 3 at snacks, compared to a lot of other people that seem to be taking a lot less than me. As far as being able to keep that food in me, I was on so many anti-diarrhea meds. I take Lamodal still, just in the morning and just at night. I was taking that probably like 4 times a day. I was taking Imodium 4 times a day. I was taking a tincture of opium twice a day. So it was a lot. It was
Yeah.
a lot. And so I'm down to 1 or 2 times a day now
Yeah.
of the Lomotil. So it's definitely improving.
And how did you, and it's improving, but over a long period of time. I mean, and for our viewers, I think Carol's, the magnitude of your operation is at the top of the list. I mean, your operation would not be done at many centers that aren't experienced with all the blood vessel stuff. But so I think that's why your story is just so important for, especially for people who may have to undergo a big operation or who are struggling with the frequent bowel movements after surgery. How did you, I mean, your attitude has always been so good. I mean, how did you kind of keep the fight going and continue to push on and allow your body to, and how you phrased this was perfect. Your body just adapted to this. But where did you find the strength to do that?
I think it's just me.
Yeah.
You know, I know somebody said to me, he goes, your mental fortitude, I just can't believe it. And he goes, I always thought your sons got it from your husband. And they're going, no, it's from you.
Yeah.
And it's just like, I wasn't going to give up. I wasn't going to give up. You know, I just knew of other people who have gone through this that were just doing so much better than me. And it just bothered me because, you know, like I wanted to be the poster child,
Sure.
you know, and I wasn't. And that drove me crazy. And I just had to understand the magnitude of this surgery compared to others and just realize I had to be patient and just do what needed to be done. I did have to go for biofeedback. I see a GI doctor. We went for biofeedback and so forth to just see what was going on, how I could improve. I had a lot of pain with my bowel movements. And I mean, it was extreme. Like I was in labor. You know, it was,
because of the distension and the gas.
Yeah.
That's what causes that cramping pain.
Oh, I know. So many times I'd lay there and go, there better be a baby at the end of all this. You know? But, and then what my daughter-in-law, who is a physical therapist and specializes in pelvic floor, she goes, I think you got a lot of scar tissue. And so she did this visceral manipulation and just really worked the area.
Oh, that's great.
And that improved drastically.
Wow.
So I just knew that there were things out there that I had to investigate and try.
Yeah. Oh, that's great.
Yeah.
Well, Carol, thank you so much. If you had to give 1 or 2 words of inspiration to people who may be a little down in the dumps now because they either just got a pancreas cancer diagnosis or they're deep into treatment and they seem to be experiencing more side effects than they anticipated, how would you give them the superpower that Carol Rubatt has?
Oh, I don't. You just have to be positive. You have to have faith. You know, it's like, you know, you got to do it. You've got to do it because what are your other choices?
Yeah.
You know, you just have to, you know, you can't worry. Worrying is not going to give you more time. It never does. You just have to have the positivity, like, I'm going to do this because what are my choices?
Yeah, great point. Well, Carol Rubatt, thank you so much. Thank you for joining us and thank you for everything you do for the pancreas cancer community. I love the purple.
Yes.
Okay. Thanks.
Thank you.